Do you suffer from sciatic pain or sciatica? Have you ever wondered if it corresponds to a true or a false sciatica? These and many other questions will be answered during the video. Hello friends! The approach and treatment of a true sciatica and a false sciatica is completely different. So today I'm going to teach you a series of very useful tips that will help you identify and differentiate them. There are several health problems that can cause sciatic pain. This is a very characteristic pain that starts in the buttock area and can even reach the foot. This time we are going to learn a series of tests that will help you identify the origin of the pain. The most common cause of sciatic pain or sciatica is the existence of a herniated disc. Only in the United States there are more than 3 million cases of sciatica annually, among which 2.8 correspond to a true sciatica caused by a disc problem and only 200,000 to a false sciatica or piriformis syndrome. So let's start with the tests that suggest the existence of a true sciatica caused by a disc problem. Let's get to it. In the first test, we lie down on our backs. The therapist raises the painful leg until they notice tension, onset, or increase of pain. We keep the leg in that position and bring the tip of the foot towards the patient. If the patient tells us that the pain significantly increases, we could be dealing with a case of true sciatica caused by a nerve pinch. If the patient only feels a slight stretch in the calf or hamstring area, the test would be negative. For the test to be positive, the patient should report a severe increase in pain along the leg, even up to the buttock or lower back. If you don't have help, you can perform a similar test. Sitting on the edge of a table, we stretch the painful leg, and at the end of the movement, we flex the tip of the foot towards us. If this movement causes the onset or worsening of pain, try flexing your head forward. This cervical movement adds tension and should worsen the symptoms. We must differentiate the increase in sciatic pain from the increase in muscle tension in muscles such as the hamstrings, which are commonly shortened. A very simple test that you can do without anyone's help is to try to walk on your heels and on your toes. If you do it without difficulty, and above all without a difference in strength on both sides, it means that your nerve is sending the signals correctly to the muscle and that the motor part is not compromised. If, on the other hand, you find it hard to lift one of the feet or you can't manage to stand on tiptoe, would we be dealing with a more serious case of radicular compression? False sciatica is caused in most cases by piriformis syndrome. The piriformis syndrome is a condition in which the piriformis muscle suffers from a contraction or spasm that irritates the sciatic nerve that passes underneath. This causes pain in the gluteal region and can even lead to referred pain in the back of the leg and knee. Most of the time, and unlike with a herniated disc, the sciatic phase will not be accompanied by lower back pain. So the first thing you should do is palpate the gluteal area on both sides in search of the piriformis muscle. I'm not asking you to locate it exactly, just to feel it with your hands. If one side feels tenser than the other, from the hip, guide your hands towards the buttocks to find it. Next, test its flexibility. Use your hands to bring your crossed legs towards your chest. Do you notice one side less flexible than the other? More tense perhaps? Note your sensations. If you start to notice that the more painful side is the more tense side, it's a suspicion that you might be suffering from piriformis syndrome. Then, subject the muscle to a contraction. Lying on your side with your legs bent, open your knees apart, apply resistance to your knee and check how the muscle behaves. Is there a side more painful than the other when contracting? Does it perhaps correspond to the side of the sciatic pain? Finally, the most determining test to locate the piriformis syndrome is the following. We lay the patient face down, bend their knees, and let the legs fall to each side. If we find a shortening or decrease in the site's amplitude, worsening pain, and we also find tension to palpation, less flexibility when stretching it, and pain to active contraction. That is, if all of the above is positive, it is very likely that we are dealing with a piriformis syndrome. Obviously, this diagnosis should be confirmed by a health professional. It's important to know that even though we may have a disc herniation, it's possible that our posterior nerve roots are not compromised. For instance, a disc herniation may not compress the posterior roots, and at the same time, a false sciatica caused by the piriformis syndrome. This particular case can lead many professionals to make a diagnostic error, leading patients to surgery without needing it. It should be very clear, a herniated disc is not always accompanied by sciatic pain or lower back pain. We should not blame the herniated disc for all our problems without having performed the relevant tests. If you've made it this far, it's because you're enjoying the video or it's helping you. Now it's your turn to help me by sharing it on your social networks. Who knows? Perhaps together we can reach all those people who need it. I thank you from the bottom of my heart for watching the video to the end, and I hope to see you very soon.